what I hope to do is share with you the results I get and the process of how I get there. So my goal for you is to, show you my journey over the last 12 years. And I'll kind of share you my journey. At one time in dental school was going step by step. And I've learned a lot of things about it, how to get to the hoop and get results a lot quicker and much more efficiently over the years. So our agenda tonight is to teach you some key factors about how to keep things real, how to make it fun, using technology, about how and when we use that technology to engage our patients and also help your veneer cases become a lot easier to do. And along the way, I will share some things I do with lasers, because I've been using lasers for about 20 years now. And my goal is really ultimately just sharing with you my journey of the last 12 years, how I've evolved with materials, how I've evolved with technology. And more importantly, I can share just how doing some of these new things, it's making dentistry a lot more fun for me as I'm rolling into my 60s now. And as a holiday gift, over the next 45 minutes or so, I hope to give you a few pearls. Actually, I hope I give you a string of pearls, and then you get a big string of pearls for the holiday. So let's get after it. And I'll share a little background stuff with me. I'm a member of Catapult. I've been a member of Catapult for about 15 years. And, a few disclosures. When I was about to become president of the AECD, we came up with this concept of responsible aesthetics, meaning that we try to do the right thing. If we got crowding, we don't just cut teeth down and do instant ortho. We were doing, talking about using the best technology. And, I tend to be more leading edge and bleeding edge. I do test a lot of products with Catapult, but at the same time, I like to look at the research on things as I do it. So, and I'm going to share a lot of different products, things that are working for me. I'm a wet-fingered dentist, and I will continue to do that. I think it makes me much more authentic with things. And I just sharing with you, and I'm grateful that GC is sponsoring me. I'm grateful for GC for many, many reasons. I love their products, and I'm glad they're allowing me to share this with you. And I will share some products with you. And I think, if you have some questions or some comments that maybe I can use, I always like to learn while I'm, teaching. So, oh, by the way, I do have no filter. And I mention a lot of movies and make some bad jokes. I just don't know if I have enough time, but what do they say? I'm saying. So anyways, here's a little piece of trivia. When I was in Japan, I had the pleasure of visiting GC, and they're showing me the corporate video. I found out that GC started on the day my mom was born. So I had that actual revelation that I was absolutely bound to get together with GC, and it's been a great journey for many, many years. So speaking of journeys, I've had the pleasure of traveling a lot of places. It was great, being president of the AECD and getting a lot of cool gigs. And this is from New Zealand. If you definitely put that on your bucket list. But I hope Georgia is my home, and as Ray Charles would say, Georgia's on my mind. I am grateful that I got to see everybody in this picture except for Otis Redding, who unfortunately passed away before my time, but I'm very, very lucky. And I get to maybe not be a rock star at this level, but I get to be a rock star nevertheless. But I also live in Atlanta. And Atlanta is famous for a lot of things. Atlanta is famous for traffic. If you've ever been here, you get beyond the airport, Atlanta is famous for their traffic. But it's also famous for Ron Goldstein, who taught me my senior year in dental school about cosmetic dentistry. And I'm absolutely grateful to learn cosmetic dentistry from literally the Babe Ruth of cosmetic dentistry. And fortunately for me, I've been able to meet a lot of great people. Jerry Sheesh, I met him when he was at LSU, and thankfully he moved to Augusta, and I got to spend a little more time. He's been very generous at sharing a lot of things with me over the years. And I literally and grateful for the team that I'm surrounded with. I kiddingly say I'm Hugh Flax in the Teeth Street Band. I'm a big Springsteen fan, and these ladies really do a big help. And this is where I get to play every day, at least 4 days a week, seeing patients, and it's a lot of fun. And this is my youngest child in my family, Josie, and always giving me good kisses. So let's get rocking and rolling here. So USA Today, which I consider the weekly reader for adults, did a survey back in 1997. And in that survey, they asked very simply, what would you want to change about your physical appearance? And the answer was the face. And what part of the face was the thing that you'd want to change? And it happened to be the teeth. I can't ask you that question because I couldn't see any answers, but this is a dental seminar, so this worked out really nicely. And with that being said, I think our profession should be grateful for the stuff that Bill Dorfman and many people did with Extreme Makeover, because all of a sudden veneers became a part of our language, our common everyday language. People would watch that show and they would call and say, hey, I saw what they did on Extreme Makeover. And I said, can you do that for me one day? And of course, it's a reality show. But nevertheless, it raised people's eyebrows and what was possible for them. And along the way, we've also had a little shift in our culture because people have moved into the United States. People around the world are having cosmetic dentistry done, and we have a difference in expectations with people. Some people want bright white, some people want it natural, some people want it, a grill. It doesn't matter to me. I just want to make sure whatever I do for my patients, they're the president of their body, they're president of their smile. I'm going to do the very best I can to meet up with that. I just don't do grills. Okay. So I've limited my practice to non-grills. But, cosmetic dentistry or aesthetic dentistry has remained the same in multiple ways. I mean, the aesthetics is the same, the biology is the same, but function has changed a whole lot. We used to think that cosmetic dentistry the function was all about you were grinding your teeth, and maybe you were having trouble at home, and maybe that's why you're grinding your teeth. And, obviously social media has changed things, but you know what? The internal stresses have become a big, big part of the problem. I mean, depending on what you eat, and depending, let's say as you get older and you're trying to deal with stress, sometimes people will take Wellbutrin and cause you to grind your teeth. And of course, there's issues with sleep, because a lot of times Jeff Rouse and a lot of people have shown this, that there's a triad of problems. When you have sleep issues, you can have the wear on the teeth and just the acid reflux that people are having. And so our occlusion and our skeletal base and the TMJ have definitely become part of the equation. Probably the biggest thing that's changed is the economics. Patients have sometimes extreme expectations, and they expect chair time to be very minimal. And we've had to become more efficient, less invasive, and make it affordable for people and repairable. And then there's these things called DSOs, and I'm not going to spend a lot of time getting on my soapbox about that, but because everybody has to do what they got to do. But it's definitely changed the way we've all had to operate in many ways. So there has been a need for change. And this sounds like I'm running for a political office. I definitely am not. But with all the factors that I mentioned before, how we perform dentistry has to fit people's time and financial resources, but also, how we provide information to people. People don't want to read long things. They want to see pictures. So I think that's really changed how we do things. So we've had to be very, very diligent about leveraging their time and our time as well. And at the same time, being innovative about how we go about doing it, which makes it fun as well. And we've had to be, creative along the way. And, dentistry at one time, when I was in dental school, back in the, God, it's almost 40 years ago. I graduated, and everything was this pyramid of, well, you got function and biomechanics and the gums, and then you do the aesthetics. And they would always tell you, don't make a beautiful temporary because they'll never come back. If I make an ugly temporary, they're definitely not coming back. So I think that I owe it to my patients. And, people like John Coyce and Frank Spear have actually said, why don't we look at the smile and start there, and look at the incisal plane and where the smile fits in the face, and make it facially driven aesthetics. And I think that really resonates with me, has resonated with a lot of our profession as well. But we've gotten more into interdisciplinary care. When I was in school, nobody was supposed to do perio, and here I am doing lasers, and people are placing implants, and then we're doing Invisalign and all these different kinds of things. And then, oh yeah, people are doing lab cases. They're printing, not only printing models, but they're creating restorations for people with a CEREC, or where they're printing them. It's pretty crazy, all the technology that continues to evolve in our profession. So one great thing I'll share with you is I think everybody should be checking this site out. I am a big fan of Dental XP. I think you'll learn a lot about interdisciplinary care, but the key to creating great smiles is you've got to have a vision of what that is. And I'm going to share with you, I think, a roadmap of things as you go through this journey. And I think that you've got to look at the face and understand that at least when you're planning the cases out, you got to look at the middle part of the face and the lower part of the face. They do need to equal each other. There's wear and tear, and bites collapse and so forth, and you have to take those things into account. One of my big things is matching the midline to the glabella, and sometimes that doesn't work. And I have patients, and this is, I think, a key thing to be able to recognize and manage people's expectations, because I have people that come in and their midline is way off, and they're saying, hey, I thought you were going to fix my midline and all that. And it's like, well, yeah, I can. I'm going to have to send you a surgeon. And sometimes they kind of back off on that expectation. But I like to keep it real with people, and I like to, make sure that I create a safety net for my patient, so that I'm collaborative with them, but also want to create a safety net for yours truly and for my team, because sometimes people come in with unrealistic, dysmorphic expectations. So I like to have the incisal edges parallel to the incisal, or not to the papilla. And also I like to, and this is a great analogy that I share with my patients, and my staff does this now. This is Larry Rosenthal's Broadway play. Your smile's like a Broadway play, and the teeth are the actors, the centrals are the stars of the show, and everything else is supporting actors, and the gums are the scenery, and the lips are the curtain. I think that helps people understand what we're up to. And not every face is the same, not every smile is the same, not every set of lips is the same. One size doesn't fit all, and you have to manage that expectation for people, because if you don't, you could get the teeth and the gums right, but if the lips don't match, you're in a heap of trouble. So you got to point these things out to people. I like to have a smile design based on looking at the convexity of the lower lip. I think that creates a youthfulness. And when I see that that's not apparent in my patient's pre-treatment, it tells me that usually there is something that's going on. Usually that's a functional issue, and you can see that when you go under the hood. And I'm big on gingival symmetry. One, because I think it's important, but number two, I have the power to do something about that, and I'll show you some things that we do. I like the centrals to match each other, as well as the CEJ, the canines. And the laterals, I like them to be a little different. I don't want smiles to look like dentures. So I try to keep some naturalness to it. Axial inclination really is a key thing in terms of creating that beauty and that harmony in the smile. And then if they're tipped out, usually that means to me there's probably something going on functionally as well. So color, we could spend all day with this. This is really key to create that multi-chromicity, that three-dimensional quality to that, whether you're doing it in your bonding, whether you're having your lab technician building your porcelain. I think that's really key, and you got to be able to communicate that well. I use Claude Sieber's book quite a bit in communicating with my patients as well as my lab. And obviously, you've got to have some texture in there. I don't like creating chiclets. That's for somebody else to do. And I think that's really helpful. I think patients really love when we take that extra time to talk over the details. So one of my favorite slides is this one, that you have the centrals, the stars of the show should have a 75 to 80% width to length ratio, and the laterals should create that charm, and the canines provide that strength, whether they're worn down or they're pointed. Those are all these things are important in creating that character and the combination of what's the best smile for you. So with that being said, you gotta, I think people get very over analytical about a smile. I could just look at a smile and say, is that pleasant? Is that great to look at? Obviously, the one on the top is very pleasant. The one in the middle and at the bottom isn't so pleasant. But one of the things I do look at is aesthetic risk. When they're smiling, do I see a lot of gum? Because the bigger the playing field, the more risks that I have to deal with. And I let my patients know that. They say, I don't want to treat the gums. It's like, well, if we don't treat the gums, your teeth aren't going to look as good. Is that the risk you want to take? So I put the risk on them. And if someone isn't, really communicative and understanding about that, maybe it's somebody that I shouldn't be treating. So I think all these rules relate to smile design. Jerry Sheesh was nice enough to share a few slides with me. And Steve Hsu, who practices with Dennis Tarnow, did a great study about natural teeth. And it's not the sizes of the teeth that's important. It's the relationships between the centrals, the laterals, and the canines. And if you think about the centrals are on the average 2 millimeters wider than the laterals. And like, why is that important? Well, let's say you're missing, and this is very common to have a congenitally missing lateral, and your orthodontist is trying to optimize the site, and maybe the periodontist is also trying to work with this. And they asked me, what size space? How much space do you want in there? And I said, just look at the centrals. If that's a natural central, just figure 2 millimeters less than that natural central. It makes it really easy for them, and I can be an advocate for my patient. There's no miscommunication about what we're looking for. So this, if you want to take a picture of this slide, this is, I think, one of the key slides, rules that you want to show at least 3 millimeters of white, and the average central should be about 10 millimeters long. Obviously, that 75% width to length ratio flies here with that 7.5 millimeter width, and you got to have the midline vertical, even if it's off just a little bit to the side. If it's not vertical, it's a big distraction to your slide. You don't want that. So my strategic plan is to figure, okay, where is the incisal edge going to be? And then from there, then I know, okay, how long do I want that tooth to be? So I'll look at the smile and I say, where's the incisal edge going to be? And then, okay, how long is there gum in the way? Do I need to intrude the tooth? Do I need to trim the gums? These are all key things in this, and I go over this a lot in my lectures. And then if I'm going to place an implant, well, I want to have that implant at least, I like to go a little bit subosseous on there so we can have less bone loss there. And I want to have a good 3 millimeter collar around that implant so we can have beautiful emergence profile as well. So I plan my cases with a mock incisal, and we'll talk about this in a little bit. And then once I decide what, and the patient says, okay, I'm ready to move forward, then we do a full wax up. And then with their provisionals, we work with a final mock-up on that. So, and then the next thing is, how do we communicate with our patients? And I like to be able to keep it really simple. So years ago, I got ImageFX. It's a great software. Unfortunately, it's not really supported that well, but it was kind of an etch-a-sketch to show people how to do it. It's rather primitive, but it's still useful. But I learned that I want people to feel differently when they're in our office. I want to create experience for people. And everybody and their mom in dentistry was starting to get imagers and stuff like that. And I want to create a different experience for people. And fortunately for me, I work quite a bit with Team Atlanta. And when Christian Coachman was there, one of the things he discovered, it was very difficult to talk with all the players in there. So they had to do a lot of digital communication. And that's actually where DSD came out of. And why is that important now? Well, most people want to see things rather than read it. And you get much better case acceptance and patient satisfaction when you communicate with pictures. So, and as Christian and I became friends, he was nice enough to share this. And when you think about the dental treatment journey that people go through, you can look at the marketing and the planning and the presentation and performing it. And it's a really conundrum. It's like, which is the most important part? Well, when you think about it, if you don't do a great presentation, you don't get to perform it, or somebody calls and asks for their x-rays or something like that. And that's very disheartening when that happens. So I wanted to become a better presenter to people. My dad, God bless him, he was in sales. He always said to me, get people involved. So I try to demonstrate with my patients a passion for dentistry. And there's so many distractions that people have. They're worried about pain and discomfort and all these things, and the grinding and the noise. And then they have all these other distractions about, I want to get a new car, or my kids need ortho, or all these other things. Dentistry is like the bottom of the barrel with a lot of these things. So we have to be thinking, okay, how do we get people to fall in love with their dental care? And then anytime you think about it, anytime you have to make an emotional decision, and instead of justifying it, it always comes to, I've thought about this emotionally, and it makes sense to me to do something about it. So when you think about it, people think about things in a left brain and a right brain. And most people, when they make a big decision, use their right brain. So when I'm asking people to look at their smile, I don't show them the mirror view because they get very, very anal retentive. I rather show them the mirror. And as I got into DSD, this is what a dork I was. I used to show, the first few cases, I would show people this slide, and it was like, they looked at me like I had a third eye, and they said, what is this? It was great for the lab, but it wasn't really great for my patients. So I got with the program, and I learned from making mistakes. That's the way to go. From this patient, and I started with this patient. She referred to me and by a buddy of mine who is a very famous bass player. And she said, I hate my smile. I look like witchy poo. And she said, I want to look like I used to. And anytime anybody asks me that, I said, well, show me what you used to look like. And she showed a very beautiful smile at that time. And she'd gone through ortho and orthodontic surgery, and things just didn't work out. Biomechanically, plenty of bone around the teeth, and the teeth were strong, but look at all the wear and tear that she had. So in order to give her the smile that she deserved, I went ahead and waxed this up. And I don't use wax, I use composite. It's easier for me, and create a matrix on this. And you can see here, she's seeing how beautiful her smile is. And I don't know if you can hear this, but you can see all of a sudden she could see her teeth, and she had hope. And she's a social worker, and she got the motivation to move forward. So we deprogrammed her, waxed this up, and we built this case out. And what a different smile. She's left social work. She started her own business, got a boyfriend, and just her life. Her life is lit up as well as her face and smile. And what a difference we made for her in terms of the tissue. and the teeth. But I learned from there that I don't like doing wax ups, and I'm going to do things more digitally. And thankfully, DSD got a lot easier. You could use the DSD app, and I created this multi-purpose room so that I can not only take photography on my patients, but we could also present cases to people. Here's a little tidbit, Bay photo. If you want to really make your smiles look very artistic and cool, this is a great one to go to. Anyways, one of my patients came in. She had a sleep appliance, and she was not particularly happy that her teeth had shifted and she couldn't chew her food anymore. And I said, well, you really should do orthodontics. And she said, no, I don't think so. So I did the DSD app on her, showed her what was possible. She became very, very interested in that. And I used the DSD motivational planning, and they sent me the digital model, and we did a mock-up on her. And when I do mock-ups on people, I show them on a big screen in my room what they had before and what they have after when we did the mock-up. And it becomes a slam dunk for people, because people become like, wow, I could do this. And they don't want to step back. They find a way to get their treatment done. So this is Pat in her before, and there's just her mock-up right there. So we went ahead, deprogrammed her, waxed her up. And this was a veneer prep case, additive case, which made it even more fun. And here she is, and her teeth looked much more extraordinary. And she also was able to bite a whole lot better. So she was a very, very happy camper, and she's been very generous with her referrals to me as well. And with technology, people get an iPhone, and they got to get the next new iPhone, or with technology in dentistry, everybody's looking for faster and better. And you get to a point where, like, when is good enough anymore? When do we want to say, okay, I don't need to buy into this obsolescence thing? And, how much does this start costing you? And then on top of that, you got to train the staff on new software and all these things. So it's a really big challenge. It's bigger than the days when I first started, when we really didn't have to change technology that much. Digital dentistry, I believe, the future is now. I know a lot of people are still sitting on the fence, but I truly believe that you got to start getting your feet wet. And actually, the ADA did a study last year and said that more dentists are making that a priority in terms of their CE, which is good to hear. But, I think the three challenges that I found we face is you got to get a good scanner. And if you want to go ahead and have an output from that scanner for the office, you got to have a printer for that. And then if you want to, you can design it, or you can send that out. So I think we're going to talk about that. And how do you integrate this technology? I think it's a real challenge. And I think with anything in dentistry, you got to have a system for doing it. And you can't do it all at once. I know people who take all these, continuums, like on, let's say, the Coy Center, and they take all these courses and they try to get it all done in like a year. And it's like, how do you get a chance to implement it? You've got to do it methodically. At least I do it, because you got to understand it. And I think your team has to understand it as well. So we've evolved from 1975, when the first Sierra came out, to 2022. All these different scanners have come out. It's absolutely crazy. And it's not only crazy to see it, it's crazy money that you have to spend. So you got to pick the right ones. And I've had 3 different scanners. And so far I've seen all these benefits here, but I think the reality is scanners don't do everything. I think you have to understand there are some limitations to them. And I think that one size definitely does not fit all. And especially when you got subgingival margins, I think you still have to go PVS on things because it's hard to pick that up. The scanners don't see that deep. So you have to be thinking, hey, what is my backup? But I like to do digital as much as I possibly can. And recently, about a year ago, I switched into the iTero. And I love that because I'm not just focusing on the restorative part, I'm also, and my hygienists love this because they're handling the diagnostics. So I walk in the room, my patients have a greater understanding of what's going on in their mouth. They see the bite pressures and all those incredible things that this scanner can do. And they really get educated on that. And they understand that orthodontics can be a preventative way to keep their teeth, their smile from aging. And the beauty of the iTero modality is you can go right into Invisalign for patients. It's made it a lot easier for people. And if you don't like Invisalign, that's your choice. I actually didn't like them for a while, but I see the advantage of it. And then, of course, you can do great stuff with your restorative. And I love taking implant impressions is without all that mess in people's mouths. My patients really appreciate that now. But printing has become a huge industry. What was it, $9.5 billion? I'm not even sure that statistic is even true anymore, because people have print farms and all this. It's amazing the stuff that people have. I've chosen to go with SprintRay. I love the way everything flows on that. You can choose every printer. There's so many different printers out there, but I like the software is very easy. My staff finds it very fun to work with. They don't have a lot of hard stuff to deal with, and we can get prints done very quickly, and a lot of other things I'm going to show you as well. But when it comes to design, you have to make that choice in terms of whether you want to have somebody else design that, or do you want to do it for yourself? And there are pros and cons to doing that. If you do Portal, you're not going to have to spend as much. And with the self-design, you have to learn a lot along the way. But I like the idea that I can get a wax up done in an hour. Let's say somebody breaks a back tooth and they have nothing for me to refer to. I can do a wax up of back teeth in 5 minutes now. And we print the model and we can do a putty matrix and we're ready to roll in just an hour or so. So that really helps. So, and when you're looking at doing design, I truly believe that these partner designs are really helpful. And if you don't want to learn the software, I would say go with some of these companies like SprintRay. They'll design bite guards for you. Evident can do your wax ups if you want. And I like the self-design because it was fun to do that in front of my patients. And when I had my CareStream software, I found out that they actually had partnered up with Exocad. And I thought, like, wow, this is great. I could actually show people what I could do. And it was great up to a point because they did not have the ability to print things. And that didn't work. I mean, I don't want to show, if I want to have a three-dimensional experience, then I need to be able to print my models. It didn't work, but it did work on this case. This is my old office manager. And I could show her, hey, yeah, we can try and do veneers and so forth. And she liked that. I did a mock-up on her. She liked it, but you know what? I said, do you really want to look like that? Because your front teeth just look too prominent there. And I showed her with Invisalign doing a design on that. She saw, like, wow, I could conserve tooth structure and save her money. So this is her before and this is her after. She's much happier, and she also didn't have to spend so much money here. But one of my dental assistants who worked with me, God, way back when, 2008, came back to me. She saw all the cool stuff we were doing back then. She says, when I do my veneers, and she had some very primitive veneers done, they were a bit bulky, but she was happy because it enhanced her smile. She says, I'm coming back to you. So when Kelly came back, I was able to show her digitally, and she knew that her gums had changed around the veneers, and she knew that we had to look for it from a global point of view. So one of the things I did to make it easier for her to see things is I used this very, very simple software called Preview. And your hygienist, your assistants can do all this work here. It's very, very simple to use. But I take over when it comes to doing the Exocad. And very simple. I'm not going to take you through everything on Exocad, but what's great is you can go ahead and take a set of models. It's already mounted, and you can go ahead and do your design on this in expert mode. I like this as a adjunct to doing the wizard, and I create that wax up, and then I just kind of fit it into the face. And this was great for my lab technician to see, but also it was great for Kelly to say, okay, hey, I like where this is going. And with Kelly, she was very, very concerned that I was going to take away any tooth structure. So I was able to show her right here that we weren't going to take away much tooth structure, really going to take off the veneers and just kind of adjust the gums and create some better margin. And then I expand her smile into the bicuspids because I want her to have a big, broad smile. So we create the models, and it's very, very simple to do. Kelly travels so much, so we didn't do the mock-up on her because she was already sold on it anyways. But I sent the design to MJ, and we went ahead and we were able to create her smile. And we're double checking our stuff. We got some time. So I want to share just 3 cool things, because there's some things in here that obviously you may need some time to implement, but it's some things that you could implement, maybe not the next couple of weeks because we're all taking some vacation, but some things that you could do after the first year. And I'm a huge fan of Stella Life. If you're doing any surgeries or any cosmetic cases, this is a big, big help because it's got arnica in there. And it really helps the gums heal. My patients do not complain about their post-op swelling or anything. And what also helps is using the wand. I do the STA on the palate, doing the AMSA injection, and right after their smile is designed in terms of the temps, they get to see what it looks like. Only problem is a lot of them are a bit dazed and confused with the sedation. But when we put the veneers in, they get to see it immediately, which is a lot of fun. Another great retractor in Ultradent, it seems like they don't really talk about it a whole lot, but we tested this with Catapult, and I love these umbrella retractors. They're very, very comfortable, and especially with patients that tend to gag a little bit.
Ladies and gentlemen, welcome to my underground lair.
Little Austin Powers for you. Probably, unfortunately, didn't get to hear it, but I started out with my laser and sculpted Kelly's gums because I knew we need to move that up and have it fit with the design that we were creating for her. A little bit of pre-priming. And what was really great, I'm using a Photona laser now, and you just see I'm popping veneers off because that was important to her. She did not want any tooth structure removed, and I'm going to try and move right along. After I got the veneers off, we had this tooth had a lot of damage before, but I preserved a lot of tooth structure for her. And after we prepped, we created these beautiful temps for her. And excuse me, I skipped that, but I got to keep things rolling along. After I put her veneers in, this is a Genova laser that's part of my Photona package. And it's an ND-YAG laser, and it's great because I'm doing photobiomodulation, which helps the tissues heal faster and makes my patients a lot more comfortable when everything wears off. I probably do it, kind of obsessive about that stuff, but I want people to have a great experience. And also, this is great to use this along the jaws because they've been open for a while, and this helps the jaws heal, makes them feel a whole lot better. So there we are, immediate post-op. Kelly is very, very happy. She's seeing a much bigger smile, and she's moving up the corporate ladder. So she's really excited about how natural it looks. She didn't want something that's jacked up at all. So she was looking for more of a B1 shade. And I love the B1 shades a lot. It gives me a chance to create a beautiful natural smiles. I think that, you know, when we get into the bleaching stuff, it's nice, but sometimes it's a bit obsessive. Years ago, I used a porcelain called Authentic. It was a pressed ceramic that was very warm, very natural. It was the most beautiful porcelain I ever worked with. And when we switched into Emax, I noticed that it kind of had a bluish look. Thankfully, GC came out with Lisi Press, and I found a wonderful lab technician, MJ Shin. You may have seen on Instagram. She's just masterful about designing shades and colors and textures. And I love about Lisi Press is it's bright, it's natural, it's warm, it's got fluorescence. And one of the added values of Lisi Press is this thing called HDM, high density micronization. Most of the lithium disilicates focus on larger particles versus focusing and not so much the matrix. And the key thing with the particles, if you have smaller particles in a glass matrix, things come out smoother. Look, we can build some more light into the porcelain. They don't look as bluish, and it has much greater fracture resistance. So, and the nice thing about this particular product is you can use it with all different kinds of cementation protocols, even using it with GSEM1, which I think is the Swiss Army knife of cements. But with veneers, I feel more comfortable having some control over things. I tried bonding a case with just GSEM1 that did not work well, and I had to kind of really pivot very quickly on that case. So I like to take my time and insert things. And before I bond my veneers, quick little tip here that I learned from the Koi Center is to use a prep start. Air abrasion has improved the bond strength of restorative materials. Statistics are showing that you get a 25% increase in the bond strength. God, you can't beat that with a stick. It's kind of like, how can you take 10 strokes off your golf game? So I really, really love using my air abrasion. I use it for everything. And then one of the great revolutions in cosmetic dentistry is to be able to use bonding materials that have very, very low film thickness. That I like the idea of being able to cure my bonding material before I put the porcelain on. So, and when you can do it in one step and have multiple modality, it's flexible with a lot of different modalities. This has been a really great thing, and a Premio Bond is one of my go-tos for sure. One of the things I've been blessed to try a product, and I use this in Kelly's case, is this veneer cement that GC is coming out with. I think they're fine-tuning it. And it's just very easy to dispense, and it really, really has a nice glow to it. And here's Kelly right before. Here's Kelly after. Big difference. She didn't have these large looking centrals. Everything looked proportional, and just really great veneers. You can look at everything up close, just how natural they look and how proportional they are, and just the reflectivity. MJ just did a beautiful, beautiful job as always. And Kelly, being a dental professional, was extremely grateful that we were able to take care of business for her. And when she was hiking with her fiance in Alaska, she sent me this picture. It's just great to see how happy she is. And it's a very natural color. It was a B1. We just gave it a little extra pop with the cement, but that was really it. So as we are starting to wind down here, actually, this is a picture from the Cesari brothers in Maui in Hawaii. And they just do some great underwater photography, and just beautiful to see how nature is just something to behold. And I think that our smiles should be something to behold. So I'm going to share some conclusions here that I think that if you're going to create makeovers for people, it's critical to use the right tools. I think it's great for your artistic happiness. It's important for your joy, and it's really good for business because patients are seeking people that one really care, that are no pun is they're authentic and really are passionate about it. So and I think that it's key using all these different modalities in terms of your preparation. I've been a laser guy for a while, as I said, and I think using abrasion is really, really cool. So I hope I've given you some great building blocks tonight. I truly believe that as we roll into another year, I know everybody looks at like New Year's resolutions and stuff. I don't believe we should be the victim of our circumstances. I think we can create our own circumstances. And I love this quote from the past British Prime Minister. And as my dad would say, because, I show my mom, I got to show my dad, all he's got to say, all you got to do is just try a little bit harder. So with that being said, it's been pleasure to share this with you. And wow, I almost finished on time. So let's see, we got a few questions. Thank you for that very nice compliment. I appreciate that. We got a couple of questions about air abrasion. And I'm noticing, let's see, where do I buy it from and so forth. So I bought mine from a company out in California, and it's called a Prep Start. They've recently changed ownership in the last year. So you can look up Prep Start on the internet. Each of them is about $2,500. I now have 3 of them because they're kind of a pain to move into other rooms. And I would obviously, I would recommend you get one. It'll make your staff happier. And what are my favorite cements? That's a great question. So I think the cement that you got to choose is going to really depend on your prep design or how much occlusal space you were able to create. So if you have a short prep, you need to be bonding. Ideally, one of the things I like, particularly in the posterior part of the mouth, is where I can use the GSM-1 on a patient that has a short prep. That stuff is rock hard. It's become a go-to thing. I've had people come in with broken front teeth. They were referred by a friend, and there's not much prep length on that. And I will go ahead and use that just to help them get down the road. And as far as I guess I could say I have geographic success, but I asked their friends, like, how's they doing? They said that tooth is still working. So it's nice that I have that in my quiver of tools. But at the same time, I think the ideal prep is to have something that's longer, at least 5 millimeters long, so you get good retention, nice, reasonably parallel walls. So I like to use things that will regenerate, remineralize teeth. There are several that are out there. I know GC I've been using Fuji for a long time. I think that's a tremendous product. Doxa has a really good cement as well. And then another product that Bisco uses. I'm just being fair, what do they say, fair and balanced. I think Bisco has a good one, Theracell. So I really like that one. So great question. We can spend a lot more time on that, demonstrating that, but we're kind of limited on time. And let's see, do I have a course to recommend for hands-on crown online veneer preps? That's a great one. Of course, I'm a big fan of the Koi Center, and they have a restorative part of the continuum. So that's really good. There's some online, Steve Phelan has a great one for online training. If you want to do that, a lot of people like to do that online thing. It's challenging for me to give lectures to that. And I think it's more fun for me to go to a course and just schmingle with people. but at the same time, I think that the cases I like, or the training I like to do is good. David Hornbrook still does great stuff. And so those are the ones that just come to mind. And if you want to email me, hey, I heard about this course and so forth. Everybody and their mama is teaching a lot of these things now. And I think it's important to find the right course there, because I mean, your time is valuable, your finances are valuable. I don't like to see people waste their time. Let's see, somebody's asking me about hypersensitivity after cementation. Great, another great question. So I think that if you have a very disciplined protocol, and I'll share this with you in just a second, you have less hypersensitivity. I think hypersensitivity is going to be increased if your cementation and your temps are leaky, or your occlusion is a little bit off, because those pulpal tissues will swell. And if you're doing veneers, you're probably not going to have so much problem. But one of the key things that I'll just share my protocol, because we're starting to run down on time, is after I take my temps off and try everything in, I go back over the preps with my prep start, and then use Conceptus and just clean the tissue, disinfect those areas. And then I, after I etch and open up those pores, and there's some debate about this, but I believe in using Gluma. I know it's expensive, but it saved me enormous headaches, because I had one case years and years ago, and I'm so glad that I use that. I know there's some cheap ones out there. I just use the one that has been my go-to. I mean, yeah, you want to cut some costs. That's not a place I want to really cut costs. And I put that on that and let that sit for 15, 20 seconds. Dry it off. Some people like to rinse it. And then I go ahead and put my bonding agent on there. I haven't seen, knock on wood, veneers coming off with it. And when I do that, and then with a very clean environment, you do use very good isolation on that. And then I go ahead and paint my bonding material, cure it, and then I go ahead and cement it. Knock on wood, I'm getting great results in terms of integrity around the tissues, integrity of the veneers, and them not coming off. And also, my patients aren't complaining about post-op sensitivity at all. So, of course, I expect them to, stay away from acidic products and so forth. So that, I think, is extremely key as well. I think there's another. Do I recommend packing cord for cementate veneers? I usually prep my cases equigingival, and when I take my impression, if I have to go subgingival, I will go ahead and place cord, but I don't do it during cementation. That's just my style, because my margins are right at the gum line, and that helps quite a bit.